So I'll welcome Bharat. Hello,
Yeah.
Bharat.
Hi, John. How are you? Good morning.
Thanks.
Good
I'm good.
evening, rather.
Good morning. Good morning, Bharat. How are you?
Anybody want to say hello to Bharat? There we go.
This is,
Hello,
My
Bharat.
friend.
can I firstly introduce Bharat as he is a Rotarian. I met him as a Rotarian. He was the president of Metro NYC when Karen and I were in the States in 2012-13. He grew from being a fellow Rotarian to being now one of my very firm friends in life. And I've been fortunate that Bharat has come to Australia. We wandered around Australia to various World Cup matches, and we have this common interest in cycling. It's the one thing we've never been able to do together. But before I hang up my seat, we'll ride somewhere together. But Bharat, I'd like to thank you for joining us. I've just explained to people you're 6 o'clock in the morning, so you've done a spectacular job to get up as early as you have. You are the right man. The question was asked of me, did you know anybody in NYC who had a broad understanding of what was happening? And you were my immediate go-to person. So I don't want to steal any of your thunder. I want to give people an opportunity to ask some questions. I've had a good opportunity to have a look at your presentation. So I think it's going to cover many questions that people may have. But if I hand the floor across to you, we welcome you and we thank you very, very much. Welcome, Bharat.
Thank you, Stephen. Hello, friends. Again, it's 6 a.m. in New York, so good morning here and good evening to all of you. As Stephen mentioned, we have, our friendship has grown. We've known each other for 7-8 years now, I think, Stephen.
Yeah.
It's been, that long. And as you mentioned, I had the pleasure of being hosted by them in 2015 when I was in Australia for the World Cup, and we spent a good week together. And we are regularly in touch, and I hope I can do justice to hopefully portray the situation of coronavirus and what we've been experiencing here for the last couple of months accurately. So I don't know how we want to do this. I had sent a presentation across, which I'm happy to share my screen, or perhaps somebody from your end can share their screen, whatever is easier, or we can just go through the slides and I can talk through it if that's preferred. So
I think you share the screen. I think it's a terrific presentation, Brad. If you share the screen, and talk to your presentation, because it is very, very articulate. It's very good.
Let me see if this works. So let me know if all of you are able to see my screen.
Yep.
Okay. So I thought this would be a good starting point. Let's try to expand this. Hopefully you can see this, right?
Yep.
Okay. So I just want to provide a brief introduction on myself. I've been a Rotarian for about 10 years now, and I grew up in India and moved to the US for grad school, and have been based in New York for, now 17, 18 years. As Stephen mentioned, we have a common love for cycling, and I also have been volunteering. Our club, is a mix of fundraising, and we do a lot of hands-on projects as well. So there's some in the trenches and elbow grease. We participate in the community, and one of the photos you see here is us in a soup kitchen. Stephen, I think you might have also participated in that while you were in New York here.
Yep.
So, and then one of my roles is as a Rotary representative to the United Nations in New York, and this is a photo with Paul Harris in Evanston in Chicago a couple of years ago. And I'll talk a little bit about that also, because I have a slide on that. Our membership, we are one of the healthier clubs in the district. We have been growing rapidly, I would say, and we are close to 45 members now. It's just the nature of New York. We are a very diverse group of people. I think we have about 12 or 13 nationalities. The demographic is, I would say, from early 30s to early 50s. That's the range. I mean, we have some which are outside those range, but I would say the bulk of the members are late 30s, early 40s. And we try and do some, as I said, we do a mix of fundraisers and some projects which are part of the community. One of the ones we really enjoy is the toy drive, which we do every December. We did a Bollywood fundraiser where we raised $100,000, and we're trying to match that with another $100,000. So it will be a $200,000 grant, global grant, which we are looking to get approved, which has been a bit delayed because of the COVID situation. This gives you a bit of sense of our projects. Global, we've done a bunch of projects in India, Turkey, Africa, Cambodia. So this just sort of provides you an overview on image of what, visualization of what we do, and happy to take questions if you want to get into further details. So one of Rotary's best kept secrets, I think, is the Rotary Representative Network. As many of you might know, Rotary was instrumental in the formation of the United Nations and has enjoyed a close relationship with the UN and the different agencies of the UN. And that relationship has been hot and cold. For a while, Rotary disengaged from the United Nations when it became very political, but it has re-engaged in the last 15, 20 years. And one of the ways it stays engaged is through the representative network, where the president of the Rotary International appoints about 28 to 30 people every year to represent Rotary International to the different agencies of the UN. And depending on where folks are based, as you can see at the bottom, there's a bunch of UN organizations which are based in different countries. But my role, along with some of my other Rotarian colleagues, is to interface with the UNHQ because the headquarters is based in New York. So it's a privilege to serve there. It's the president of RI invites you every 2 years to Evanston near Chicago for a 2-day, I would say, junket, because Rotary picks up the tab, but we discuss what is the strategy. We have presentations. All of Rotary senior leadership comes and talks to us one-on-one. So it's a great experience. And then obviously we are serving on a voluntary basis, and I can take more questions if there's more regarding the network. So I wanted to dive right into the USA and COVID, as I know that is a source of interest to all of you. I thought a better structure of the conversation might be to break it out into 4 categories, which is the pandemic, the health impact, the economic impact, the political fallout, what we're experiencing and what we might see given it's an election year in the US, and the socio-economic and the societal impact. So in terms of the health impact, the numbers keep changing, but the last count yesterday, we had about 4.2 global cases, 4.2 million, and close to 300,000 global deaths, of which United States is the epicenter. We have 1/3 the global cases and 27 to 30% of the deaths. So yesterday we had about 81,000 deaths, which Dr. Fauci, who you might have heard of, and he's in the news a lot, he himself said that he feels that's grossly underreported because there's a lot of deaths, unfortunately, that's happening in homes and long-term care facilities, nursing homes, which I'll get into, which is not being reported real time. So the actual number will turn out to be a lot higher, unfortunately. And as per the count that has been projected right now, by the end of our summer, we will have close to 135 to 150K deaths, depending on what we end up with. As has been widely reported and what the data is showing, most of the deaths are in the 65 plus age group. And of the 80% deaths that are in that group, a lot of it is in the 75 plus age group. And many of them have been dying in the long-term care facilities simply because either the infection management protocols have been inadequate or the staff has been completely not trained to handle a pandemic situation. So that has been, I would call those preventable deaths. New York has been the hotspot. We've had, uh, 350,000 to 400,000 cases and 20,000 plus confirmed. The good news is we've been leveling off. We're on the decline. At the highest point, I think we were losing 1,000, 1,200 people a day. Now it's under 200. So it's definitely getting better. The unfortunate news is yesterday we learned that there's this Kawasaki syndrome that is showing up in kids. So some of the kids are showing some sort of variant of the COVID virus, which would be devastating because one of the silver linings, if any, of this virus has been that, kids have been unaffected, mostly unaffected, and that has definitely helped, I think, in some regard. So after New York, the New Jersey neighboring state, also heavily populated, has been impacted, followed by Illinois, Chicago, Massachusetts, the Boston area, and California, which has done an incredible job in managing the disease. So, New York, known as a city that never sleeps, we've been slumbering for 2 months. Not the most pleasant images to watch, but, we've had hospitals overrun with bodies, so they were hiring refrigerated trucks to store bodies. And this is an image from one of that situations. Times Square, which is bustling and which any New Yorker would tell you they try to avoid as best as they can if you live here, has been, as you can see, like a ghost town. And then again, the long-term funeral homes and long-term facilities are also seeing a lot of deaths. So that has been the health impact. Moving on to the economic impact, if you've been following the job reports in America, we reported 20 million unemployed people who filed for claims. And on Friday, which is representing about 15% of the working population. Again, that number seems to be undercounted because there's a lot of people who are not able to file for unemployment because the system is completely overwhelmed. To give you an example, New York, which used to see 10,000 filings a week, is seeing 200,000 filings a week. So there's just not enough bandwidth to handle the claims that are coming in. And also some people who were already unemployed coming into the virus situation, or who lost their jobs, are just not even bothering. They're not looking for work. So the estimates are that number might be 20 to 25% of the working population. And just to set some context, we were at a 3.5% unemployment in the end of February, which was a 50-year low. So from 3.5 to 25, I mean, that's a 6-7-fold increase. So it's just unprecedented. One of the strange things that we're seeing is the stock market seems to be going completely contrary or decoupled from the economic situation. The technology heavy index, NASDAQ, has completely recovered all its losses for 2020, and not even just recovered it, has actually, it's in the green or in the black. So it's in positive territory. And that is partly due to the fact that technology has been one of the winners of the COVID situation, because we've had e-commerce companies that are still delivering, that are still taking orders. So the likes of Amazon and any e-commerce powered company, they're doing great. Some of the technology companies, they're, as it is, based on the cloud, or you're using your computer, so people are still using those services even in this situation. It's the physical businesses, which you had the restaurants, you had bars, you had retail, that has been completely decimated, and they're going to not recover for a long time to come. And we're expecting in New York alone a deficit of $10 to $15 billion this year, which would be very hard to fill. And this is, contrary to the surpluses that a lot of the states were expecting, given that the economy was very strong coming into the virus. So for all intents and purposes, the recovery is going to look more like a swoosh, a Nike swoosh, than a sharp V, which a lot of people had been predicting. And let's see, the verdict is still out there and how that goes. In terms of the political impact, I think this would be interesting to all of you, and I'm sure I'm going to get a lot of questions on that. But Trump, as we know, I mean, he's been a naysayer. He completely underplayed the situation. Not to say that he introduced the virus, but as a leader, as somebody who could have sounded the alarm and taken steps to proactively uh, set up the country to handle the situation better, he kept saying it is just a flu. We don't need to worry about it. We've taken care of the situation. We've stopped the flights from China, not realizing that the flights from China were going to all the other countries. They were going to Europe, and then people were hopping on flights from those countries back into the United States. So it was really not helping. And then on top of that, as you might have noticed, the two people who should be leading by example are not wearing masks. This is a recent example of Vice President Pence, who was visiting the Mayo Clinic, which is a famous hospital in Minnesota. This is end of April. And he was talking to recovering patients there, recovered patients there, and he refused to wear a mask as visible. Everybody around him is wearing a mask. And as you might have heard, two people from the White House have tested positive last Friday. One of them is the press secretary of Mike Pence, and he was seen with her on Thursday, doing a delivery at a senior care facility, doing a mask delivery, and he was not wearing a mask, and even his press secretary was not wearing a mask. So right now they are in the danger zone. And Trump, as we know, he's never wears a mask. He refuses to wear a mask, and the only place he's wearing a mask is, I think, an invisible one on his eyes, where he refuses to see the situation. So, he's blowing his own trumpet. I mean, there's no secret about that. He used to have a press briefing at 5 p.m., which used to go on until 7:30 p.m. So for 2 to 2.5 hours, he would just ramble, not let the health experts speak. They probably barely spoke for 10 minutes of the 120 minutes. And then he would try to field questions from reporters, where he would very conveniently insult them and call it fake news if it didn't suit his narrative. And as a result of that, he made the most glaring statement he made was a week ago or 10 days ago, where he said that, you could use disinfectant as an IV to treat the virus, which he later claimed was just him being sarcastic, after which he has completely changed the format of the press conference. And now the health experts are no longer part of that conference. But anyway, it's an unfortunate situation because, as you know, the country is very split, it is very polarized. And one of the downsides of having such a polarized country is that there are elements in the economy or in the voter base that dig in deeper when their position is challenged. And that's what's happening right now, where Trump supporters are just digging in deeper and think he's doing an amazing job and are going to rally around the flag, so to speak, which is causing a lot of problems, which I'm going to also talk about in a couple of minutes. But one of the important things to note is that CDC, which is the Center of Disease Control, the independent sort of the health, they're the health experts, they sound the alarm, they're the watchdogs. They dropped the ball initially as well. And, there were kits available, which the WHO offered to CDC initially so that they could start testing people, but CDC refused, and they wanted to use their own kits, which turned out that were contaminated. So they were getting false positives. So that caused a whole lot of delay initially, where, we saw a ramp up in cases which could have been avoided. And then on top of that, the PPEs, which is the masks and any sort of protective equipment that the health frontline people who were helping the COVID patients needed, all of that was politicized, where he left the states on their own. They were bidding against each other, paying higher prices. And in all of this, China was again profiting, because what reports have showed is that they were importing PPEs in December and January, leading up to the full-blown crisis, and then they were re-exporting that and ramping up their own production facilities so that they could make money off of it, which is very unfortunate. So um, as a result, a lot of the states were left to their own devices to manage the situation, and um, many of them, I would say, our Governor Cuomo, Andrew Cuomo, who you might have heard of, and Washington State, which is Seattle, which is where the first case was detected, and California. I think all of these governors have done a great job, in managing and containing the crisis. Right now, Trump's primary focus is the election and the stock market. I think he should be called Dow Jones Trump because that's what he cares about, he talks about, and all of his actions are geared towards opening up the economy, especially in states where there's a Republican majority and those governors are falling in line. But even in the last 5 days, they've discovered that that might be too quickly. And even if businesses are open, doesn't mean customers are going to show up, because broadly speaking, everybody is uncomfortable with hanging out outside unless it's really required. And people go out to get some fresh air, but they socially distance. So they're not going to show up to nail salons or to try on clothes, which will then go on to the rack and then somebody else is going to try it on. So it just doesn't make any sense. In terms of the societal impact, and this is very important because, we've been all hearing that coronavirus is a great equalizer. It's a great equalizer. We're all the same. The only thing that's same is we are experiencing this global pandemic together, but the impact is being felt very differently across different socioeconomic levels, I would say, because especially and I'm speaking for the US, I know that in many countries, in most civilized countries, in most developed countries, there are social programs, there's better awareness in how you treat your citizens. But United States, I mean, it's unfortunate, but there's been a systematic underinvestment, disinvestment in health and education, and we are paying the price for that now. So it's not that these, there's a reason why United States is seeing a very high level of fatalities, because there's a high degree of comorbidity in the population here. I mean, obesity, diabetes, heart issues, high blood pressure, all of these are known issues. And that is something that has been occurring over decades. It's just that we are seeing the effects of that exposed due to the virus. So right now, what we're seeing is parents are struggling to and these are parents I'm talking about who have the luxury of staying at home, working from home. They are doing their work, they are managing the kids, they're helping kids with their education because everybody is using remote learning now. All the schools are closed, all the universities are closed. Some of them have parents that they're trying to help who might be displaying symptoms or who have health issues. But then again, people are also socially distancing, so you can't really help them, but you're trying to help them. And this is going to have long-term impact beyond the virus as far as the US is concerned. I mentioned earlier that a lot of the casualties is happening in long-term facilities, nursing homes. New Jersey is one such state where I think in just one nursing home they discovered 82 people died. I think it might have been in triple digits, but I think it was at least 80 people. And that was purely because the staff was not trained to manage, people who are older. Keep in mind that, a lot of the old people are also having dementia or issues relating to memory. So they don't understand socially distance. They don't even know what you're talking to them about a lot of times. They just are following instructions. So a lot of them did not have proper infection control protocols in place, and which is why we suspect that the number of casualties or fatalities we're reporting is going to come out a lot higher because these numbers are not being reported. A lot of people are also passing away in their homes, older people, some of whom were living alone or living with a partner, and again, all of those numbers are not being counted. Of the people, who are not able to excuse me, don't have the luxury of working from home because either they are essential workers, and typically people who are on the lower end of the earning spectrum tend to be essential workers, and in America they happen to be Hispanics, so people of Latin American origin or African Americans, and they are the worst affected. So just to give you an example, in New York, for every one white person who died, three colored people have passed away. In Chicago, for every one white person who died, four colored people have passed away. In New Mexico, which has a lot of what we call Native American population, Indian population, uh, for every one white person, there's 11 times more that a Native American person has been infected. So that gives you a sense of how it's impacting some of the demographics worse than others. In terms of we've had in America and just globally, we've had three big crises in the last 20 years. I mean, well, I would say, yeah, 20 years. We had 9/11 in 2001. We had the 2008 financial crisis, and then this 2020 pandemic. So a lot of people were just recovering from the 2008 situation, which was impacted U.S. more than other countries. And they were just climbing out of that hole, and now they're in a new hole. And this might be even worse than the 2008. So one of the things, which is less talked about um, is mental health. And that is one area also where we are finding that people who are displaying more stress, they are calling in, suicide lines are getting overwhelmed. Excuse me, the domestic violence situation where earlier if a couple or one person was in an abusive relationship and they could escape the home environment, now they're unable to do that. So even though there's been a decline in, burglaries, well, commercial burglaries have gone up, which is not a surprise, but home invasions or, robberies have broadly declined, but murder rate has climbed up, especially in New York, and that is a direct relation of domestic violence situation, which is again unfortunate and but an unintended consequence directly, attributed to the coronavirus. So, what's next? We are flattening the curve, but we in the United States are completely unequipped right now in the number of tests that have been conducted, in terms of just the regimen that is being followed, just the quantity of tests. And we know that the golden mantra is test, track, isolate, which is how most countries that have done it successfully, whether it's South Korea or Germany or New Zealand, all of them have followed this model. And in the US, currently we're doing about 400 to 500,000 tests a day. The experts are saying we need to do 3 times the tests. Currently, we don't have the test. So there are different components where I'm learning, where it's not as simple, the testing. You have the swabs, you have the reagents, you have the test tube, and currently the tube seems to be the bottleneck. So we don't have enough test tubes, which we can send to the labs. Epidemiologists are predicting there's going to be a second wave in the fall, winter, which is probably going to happen all over the place, but in the US is going to be worse because some states are opening up where they shouldn't be opening up. So we might even see a resurgence in the summer, which would again bring us, it's basically taking 1 step forward, 2 steps back. So that's a very real possibility that might occur here. Even if a vaccine were to develop, which is optimistically speaking a year away, even if by some miracle we find something, whether it's convalescing plasma or some antibody or some sort of other treatment, by the fall, we won't have enough production capability to have doses for everyone. I mean, we're talking just 300 million people in the US, so that's 900 million doses because one dose won't suffice. And then 7 billion people globally, and then even if not everybody gets a virus dose, you just get the idea. I mean, we just don't have enough infrastructure to produce them. One of the, I want to talk about this slide. I mean, in the US, in certain counties, in certain states, people order a sandwich this way. They take their guns They take semi-assault rifles, and they try to threaten the governor of the state with Confederate flags and neo-Nazi signs, saying that if you don't open the state, you are infringing on our First and Second Amendment rights of freedom. So there's been a politicization of COVID in the US, which is unfortunate because this is not a political crisis. This is a health crisis. It's an election year. Trump is feeling very insecure about his chances. His advisors are telling him that he's losing support in the battleground states. Michigan is one of them. Wisconsin is the other one. Arizona is another one where he showed up last week because he knows he's losing support there. So he wanted to just show up at a mask factory trying to show that support, but he really was doing more of a political rally. It's very unfortunate that US, which is one of the most prosperous countries, supposedly is not leading the way, is handling it very poorly. It's not listening to the health experts, is turning this into a political crisis. And needless to say, I think the citizens are the ones who are going to pay a price for it. And in my opinion, and also some of the reading I've been doing, I think Bolsonaro in Brazil, who is called the Trump of the tropics, he's following the same model. And I think Brazil is going to be the next crisis hotspot because he's again a naysayer of the virus. So hopefully, that brings me to the end of my presentation, but I hope it gave you some sort of an idea of what the virus situation in the US is like and what we're encountering. And, I'd be happy to answer any questions or any suggestions, comments you have. I mean, I'd be interested to hear about your perspective as well from an outsider.
Yeah, Bharat, thank you very, very much. And that's exactly what I think we asked for was to disseminate the fact from the fiction. And I guess when you live on the ground, you live amongst it day to day, you understand it far better. One of the first questions I've had from, and I'm not quite sure who it was from, was why has NYC suffered more than anywhere else? What's relevant to New York versus California or the others or somewhere else?
Yeah, that's a very good question. I mean, it's not surprising that the densest urban areas will suffer the most because social distancing is very hard to maintain in a place like New York. I mean, millions of people are using public transport. I mean, this whole city, the 5 boroughs, we talk about Manhattan, Bronx, Brooklyn, Queens, Staten Island, those are the 5 boroughs that comprise New York City. But then there's the suburban areas, and then there's the suburban states, which is Connecticut and New Jersey, and that's why it's called the tri-state with New York, New Jersey, and Connecticut. They're very intricately connected. So a lot of people come into Manhattan to work during the day. And that does not include office workers. There's a lot of essential services. There's a lot of delivery happening. People are using the public transport. We have JFK and Newark Airport, which are 2 of the busiest airports in the world. So a lot of international flights coming in. So I would say the spread in New York specifically happened because people are not able to socially distance. People use public transport. We are in very close quarters from each other, so the virus spreads easier. The Bronx, which is one of the boroughs in New York and has most of the people there are African Americans and Hispanics. The highest incidence is in Bronx, which is not surprising again, because again, that's low income, people live in public housing. A lot of the people who live in the Bronx work at the airport, at JFK. So they're suspecting that some of them were exposed to COVID positive people at the airport, and then they brought it back into the communities in the Bronx where they lived, and one thing led to the other, and then it just spread like wildfire. Now, Washington State, which is Seattle, they had the first case of the virus. This was in end of January, I think, where a person had returned from Wuhan. He was a 35-year-old male, and he was detected with the virus. But what they did is they followed the testing and isolation protocol very well. And that is one of the reasons why California also, which gets about I mean, it gets hundreds of flights from China every day because of the Silicon Valley. You know, there's hundreds of flights that are coming in, but still they were able to manage it very well because one, they caught it early, they isolated early, they shut down the state early, and also keep in mind most of California is driving, unlike New York City, where most people are using public transport. So any city that uses public transport is going to get worse affected. So that's one of the reasons why New York uh, is badly affected, and it jumped faster here because we are all, you know, not driving that much. And second, we were a little bit late to the party, maybe a couple of weeks late, which in a pandemic situation, you know, can be a difference between having 1,000 cases versus 10,000 cases. And also, you know, like I said, the socioeconomic factors where the people who are most exposed to the virus also are out and about because they're offering essential services. So it spreads quicker that way.
Yeah. Oh, thank you, Bharat. Mark, did you have your arm up? I thought you may have asked a question there. Yes, please, by all means. Can you demute Mark, John?
Yeah, thanks, Steve. I hope you can hear me. Is
Yeah.
my enough coming through? Sorry at 6 in the morning for asking you this question and putting you on the spot, Bharat, but your excellent presentation compelled me to ask this question. High school shootings in America seem to be a unique phenomenon. Previously, there seemed to be two options, either send your kids to school prepared or homeschool. Has the pandemic provided a third option, which is Zoom schooling or online schooling to patch into a classroom that is live via the mechanism we're using now? Has there been any press or any discussion on that in America? Because my understanding, I read this recently, that America had its first March with no high school shootings since 2003, which I find staggering. Has this been a discussion point?
You know, right now, gun control. I mean, is that your question? I guess you're asking more about the shootings, the gun control, and the whole debate about that.
I think gun control is something that we don't have enough time for. I'm more thinking about existing gun rules applying in America. There are two options as a parent: to send my kids to school and wear the risk, or to homeschool, and that way I'd have to provide the curriculum myself. Is the pandemic providing a third option now where via Zoom, kids could effectively watch a live classroom presentation online? Has there been any discussion about the pandemic and its impact on high school shootings and other options?
Yeah, I mean, it's a multi-part question. So even with you know the two options that you talked about, I mean, it's a state issue. Gun is a state issue here. So, for example, the state that I live in, New York, has very strict gun laws. You cannot carry you cannot own a gun, you cannot carry a gun, you know. And if you have a gun, like a hunting gun, if you're living upstate or something, I'm sure like it's very closely monitored. But then the other states, open carry states, and this is why I put this picture up here, because then you have states like Michigan and North Carolina or Texas or certain other, you know, Midwestern states where there's open carry, or there's you can carry in the glove compartment. So people just live with guns, and it's they're used to having people walk into a convenience store to buy, you know, a Coke can and have their guns exposed, which to me also seems like just ridiculous, you know, that you would have such a thing. In terms of the options that you talked about, I mean, Zoom is definitely being used extensively right now by universities and high schools to provide online learning, and Zoom has made it free, what I understand, for K through 12, what we call kindergarten through 12th grade, for all public schools. So that has really helped because they're under budget constraints. Having said that, you know, which is again, I'd like to bring my attention to this slide, which I talked about, the unequalizer. A lot of people who go to public schools don't have, believe it or not, either a computer or internet access, and they have to, they are either not able to attend the online classes. And in a situation like this, where earlier there would not be social distancing, people could get together, go to a library, or get to somebody else's friend's house who has computer and get the classes together. But right now, because they're socially distant, you can't even go to somebody else's home for a class. So it's kind of interesting you mentioned that, because just I was listening to a podcast last week, and it talked about how people who go to the same university, right now everybody's home. Even though it may seem like they go to the same university, once they are back home, their lives are very different. One person is at their family's beach house right now doing online education. The second person in Florida whose parents own a food truck, and they are hurting right now. They don't even have a separate room, a private space where this girl can take her classes online, which is being, which is being done by the professor, and is so stressed out that she's unable to submit her assignments on time because she's trying to help her parents. There's stress around finances. Her future is uncertain. She's going to graduate this year, and then there's no prospect of a job, and yet she has to submit assignments. So I would say, because there's a lot of inequality here, and a lot of basic things are not available, which one would take for granted, the education, despite best efforts, through delivery through Zoom, is not going to help the kids that need it the most, because those kids that need it the most benefited a lot from going to the school, interacting in the class, being around a positive influence, getting them meals, because some of them their parents can't even afford meals. One of the reasons they go to school is because they get breakfast and lunch in the school. That's the reason they go to school. So I don't know if I answered your question, but it's going to be difficult. I think, the jury is still out on that. We will have to see how they're going to administer exams, what the results are going to look like. All of this we will know in the coming year or so. Right now it's difficult to predict.
Yeah, no, you answered it very well, and it seems like the same groups that are disadvantaged, the groups that you talked about that live in the Bronx and those areas, and it's more than just the delivery of curriculum.
Yeah.
Yes.
Thanks, Mark. Craig, you have a question.
Yes, thanks, Bharat. Fantastic presentation. One of the areas that's getting increased media coverage and commentary here is climate change. I'm just interested as to what the sentiment is in America, in particular New York, in the absence of pollution in that particular city.
Well, yes. I mean, I think one silver lining of the virus COVID situation is just that, nature is flourishing right now. I'm sure the wild animals and all the other creatures in the sea, they're probably thinking, whatever's going on, guys, just keep it going, because it's been quite wonderful for the last month. So I grew up in India. Compared to that, New York is not polluted at all. It is not polluted. Having said that, it is one of the more polluted cities in the US. But, one of the advantages, in some ways it's a great time, because I don't remember, having lived in New York so long, and I live in Manhattan, I'm pretty much in the center of everything, that I was woken up by birds chirping and not by the sirens and blaring of horns in Manhattan. So in the last couple of months, I've been waking up to the city being quiet, the birds chirping, everything seems to be like, it seems like the world is resting a little bit. So there's not much talk about climate change. And again, I think it's a hot button issue, but it depends on who you talk to. New York, California, they are different worlds. We feel very disjointed from the rest of Middle America, because if anything, I have a feeling that human beings are the most irrational creatures out there. So once this virus lifts, I know in America, they will feel like they have something to make up for lost time. So they will probably drive more because gas will be cheaper. They will travel more. They will live the life. They're like, now we just have to live a life even larger because we don't know what's next. So America takes a very extreme view, and just having lived here, I mean, I can see it. I mean, I grew up in a different culture and I've assimilated to this culture, but one of the advantages is that I'm able to draw a distinction as well. And America is, the way I've understood the society here, is that it's very binary. You're either a hero or you're a devil. There's nothing in between. Like even when they portray anybody in the media, the leader is either a demon or he's a hero. So here, I think right now people are just very scared and very afraid and very anxious, and they're staying in. But once there's a cure, there's a vaccine, and numbers start to drop off, I think they'll just come back to their old ways, which is unfortunate because we can see that, you know, just 2 months of reduced air travel, reduced air pollution, you know, just the wildlife is coming back. I mean, the people are seeing stuff they haven't seen in decades. It just goes to show that the nature is very resilient, and if we just gave it a chance, it would come back. But then we are not going to do that. Especially certain pockets of the world is not going to do that. So even though I think people have very short memory, and everybody feels like, oh, you know, we've learned a lesson from this, and you know, we're going to be different people going forward. I don't think so. You know, I attribute it to the kind of, you know, the best way I can describe it, you know, when you go to somebody's funeral and everybody's, you know, seeing a burial or a cremation or whatever it might be, everybody tends to get very philosophical in life. They're like, oh, you know, I should just focus on my priorities more. Why am I running after money? And I should be spending more time with the family. And 2 hours later, they're back to square one. Somebody's yelling at their wife, and they're asking their husband to do something, and somebody wants this online shopping. Again, the point I'm trying to make is, right now we are living in in an environment where everybody's very anxious about their future. But I mean, this will change. We're not going to continue to live like this. But once that change happens, I think human beings will be back to being who they are.
Thanks,
That's my
Bharat.
opinion. I mean, I might be.
Sorry, Bharat. Is it while we're going to check, anybody else would like to ask a question? Can I see? Yes, sorry, Vicky. Yes, by all means. John, can you unmute?
Right.
Hi, Brett.
Hi.
I was just wondering, although you haven't lived there for a couple of decades, as to whether you feel the information coming out of India and out of Kolkata is accurate as to how they're handling COVID-19?
Yeah, that's a good question. I think the numbers in India are very underreported, and there's a couple of reasons behind it. Okay, that's a two-part question. There's India and there's Bengal. So Bengal is, you know, the state in Calcutta is the capital. I think Bengal is worse than the rest of India, because the chief minister there, who's, you know, akin like to the governor, she is again, she's denied. She's a naysayer. She's not testing. She's not letting information come out of the state. She doesn't like the central government, so she's not cooperating with Modi. Not to say that Modi is doing a great job. I think he needs to do a lot better as well. But in my opinion, I'm shocked at how low the death numbers and the infection rate in India is, just given the size of the country, the density of the population. I mean, we are talking a few thousand deaths. Like, that's nothing in a population of 1 billion too, you know? I mean, any country would take that in a heartbeat today. If you look at if you were to extrapolate the numbers. There's more people dying for sure. Having said that, it's still a mystery why such few people have died. Like, even if I would say, let's multiply the number by 20. Even that number to me seems low to me, given just how poor the country is, how people are not able to socially distance. I mean, if you're living in you know, like in parts of Africa and or Asia, you are living in a community where 10 families are sharing a bathroom. How are you practically going to socially distance in that environment? I mean, it's just not, it's easy to say, but it's not economically possible. So just given those hard facts and ground realities, I'm just shocked at the low numbers. And I think there is some greater power at work some immunity, or I don't know what it is, that our numbers are so low. Even though they're underreported, I think they're still low, given what it should be. So I think to answer your question, I think not everything that is coming out of anywhere is accurate, and let alone India. I think Calcutta is very, I mean, I have family back there, so I'm very intimately aware of what's going on there. The situation is pretty bad. One of my dear friends, she lost her cousin, and they're a wealthy family. So this is a real life situation. The person got detected with COVID. He did something stupid. He went outside in a crowded market he should not have gone. He's not that old. He was not that old. He was mid 40s, so not that old, as in. But he got infected. Once you get infected, you have no control which hospital you're going to end up in. And keep in mind, the health infrastructure in Bengal, in India, is not the same like in the Western world. So he got taken to a hospital. Once you drop a person at the hospital, you have no contact with them, because that's the case everywhere, I think. And in Calcutta, they were even taking the cell phones away because they were damning evidence that was being filmed on the cell phone and transmitting through WhatsApp and other medium. So one of the things the chief minister did is said, when somebody is admitted to the hospital, we're going to take your cell phones away. So you're going to be without cell phones. So they don't know what happened with him, but in 12 hours he died. He died in 12 hours. They did not give him they don't give you the body. The state did the cremation in some sort of a mass setup. Very little information was available to them as to what was the cause of the death. There's no accountability. And this is coming from a family that has a lot of means. So I can't even imagine a family that has no means or limited means. So, yeah, I mean, I think the situation in India is bad. I just think, I was just expecting it to be a lot worse, actually, to be honest with you. I'm just surprised how less bad it is. Let's put it that way.
I guess, Bharat, sorry, just interrupting, that we're still on the right side of 100 deaths in a population of 25 million, which even if you multiply that up by 25, is still very few deaths as compared to the States, the UK and elsewhere. So I think there has to be, I mean, you have to give kudos to all our political leaders, whether they be federal or state. We've been very stringent in terms of the way we've controlled people's lives. Many have complained, like in the States, we've had protests, but not quite to the same extent. But I think at the end of the day, we Australians have actually grasped the understanding of it and the severity and have done the right thing. And I think 100 deaths reflects exactly that. And a lot of those deaths could have been, had circumstance been different, saved. But at the end of the day, it looks like it's going to be somewhere around 100 odd deaths, which I think is pretty good from Australia's point of view.
Yeah.
So can I ask, is there anybody else who would like to ask Bharat a question about COVID, about NYC, about the US generally, about cycling in Europe, or anything else? If not, Bharat, I really would very much, again, I thank you very much. I was asked off the cuff. I was pretty sure that you'd come to the party, but wasn't sure. I know it's very early in the morning. I know you can now go back to bed. I thank you very, very much. And normally what we give to speakers, we normally give them a book. We run a second-hand bookstore. You may remember when you were staying with me, I may have spoken about it.
Yes,
and what we normally do is find an appropriate book. Well, can I tell you, I have a friend who finds more cycling books, and I have friends who send me cycling books. I would have given you a fantastic, I'd have given you a Cadell Evans book. How's that? That's what I would have given you. But I'm hoping that the next time I see you, which is not going to be that far away, I'm sure, I'll be able to hand it across to you in person. But I would, again, like to thank you. I've got just one person who would like to ask one more question. Sure. Mark? John, can you just demute Mark? Sorry, Mark?
No, we're just supporting.
Oh, sorry. Sorry. Anyway, Bharat, again,
Stephen.
Sorry, Richard?
Yeah, I want to get away from COVID, if I may,
yes,
and go back to your main job in Rotary, which is the United Nations. So can you give us a very, I know we're going way over, but
No,
can
it's
you
fine.
give
I
us
mean,
a very quick
oh,
rundown of how long we've been involved? Do we have a seat in the General Assembly? Do we have any rights in any of the committees? And do we have any contact with people like CDC, HHS and so forth?
yeah. So I've been personally involved, for the last 2 years. Ed Futa, who's a very well-known Rotarian, he was the general secretary for the longest time. He's the first dean of the Rotary Representative Network. In fact, he orchestrated this in a large part. And he and I, he comes to New York. He was based in Evanston for the longest time. Now he's based in Madison, Wisconsin. He used to travel a lot for Rotary, and he loved coming to New York. I mean, he's in his late 70s now, or maybe 80. He's Japanese, Hawaiian American. He always has that, hang ten kind of attitude about him. So he can drink with you, he can talk Rotary with you, he's a great person to be around. So he'd become a friend, and I think he's the one who recommended me to the network. And then the president appoints you. So New York is a bit different than other countries where we have representatives, because we are interfacing here with the UN, with the headquarters, with the corporate entity, so to speak, of the organization. While my other colleagues who are based in, say, for example, Italy or Switzerland, or France, they're interfacing more with the organization that is based in that country, the United Nations agency that is headquartered in that country, for example. So they have a more cut out mandate as to what they need to do in terms of maintaining relationship with the agency over there. For us, it's a little bit more what we make of it, because we are interfacing with the United Nations overall. And one of the things we do, which we just did in this past November, is to put up Rotary UN Day, which is a day every year where United Nations and Rotary comes together. We organize it. Usually we organize it inside United Nations. The United Nations makes the General Assembly, other rooms available to us where we have breakout sessions. But unfortunately, this past November, they were having a budget crisis. So they had shut off their facilities to all non-essential meetings and people over the weekend and after 5 p.m. So we had to scramble and hold it at a hotel in the city. And we had to also cut down the size because of the restrictions that the venue had. But that is one way where we showcase the work that Rotary and UN are doing together, where we showcase people of action at Rotary who have worked whether with refugees or with other UN bodies in the 6 areas of focus that Rotary has. And then we showcase the kind of work that they've done, and we also recognize and acknowledge them during that event. So it's a great opportunity for anybody who is appointed, because, like I said, it's Rotary's best kept secret. Many people don't even know that this network exists. And then a lot of people, the next question is, well, how can I get in? Unfortunately, the president has to invite you, and who recommends you, you would never know, because you just get a letter one day from the president of RI asking, your willingness to become a member of the network. And like I said, we meet every 2 years in Evanston. All of us, 28, get together. Rotary flies us in, hosts us. We have meetings, we have breakout sessions. All the Rotary leadership is there to interact with us. So it's great exposure, and it's a privilege to be able to serve. And to give you an example, when we're not preparing for UN Day, there's a lot of events that keep happening at the UN. There's a General Assembly event in September, which is a big one. There's a lot of commissions that are setting up events on different topics, whether it's climate change or refugee or health. And as you know that, the polio is one of the big hooks that we have into the UN, because WHO and UN are very closely joined at the hip when it comes to polio. and that is also what gives us a lot of the mileage when it comes to to the United Nations. So we are attending, me and a few of my other colleagues who are based in New York here, part of the network. We're attending a lot of these meetings, a lot of the commissions, because each country has their commission to the UN, their diplomat to the UN. So they host a lot of events as well. So we try and go to those events and try to talk about how Rotary can partner with them, if there are the speaker opportunities, whether they can come and speak, or somebody from Rotary headquarters can come and speak at the event to improve our visibility in the organization, and we can partner in programs or some funding. So that is sort of our mandate that we do in New York, at least. I don't know if that answered your question, but.
Thank you. Thanks, Bharat.
And
thank you again.
we have been involved since the very beginning of the UN, I believe.
Yes.
Yes.
So in chartering of the UN, when in San Francisco, when the signatories were drafting, the what became sort of the guiding principles of the organization, Rotary was given observer status and also consultative status during that time. They were instrumental in bringing people together and keeping things on track, and they were also documenting a lot of the content that became the framework document that ended up being signed by the member countries later on. So I would say Rotary enjoyed a very favorable status. It dropped off when Rotary, when like I said, UN became political during the wars. So Rotary stepped back, and then it re-engaged and that was in large part due to the polio crisis, due to the polio situation, that Rotary and UN came back together. I mean, right now I would say, UN itself, a lot of countries, a lot of people are questioning if UN is doing its job. And I feel the same way at times, because I feel that with the budget that they have, with the infrastructure that they have, with the credibility that they enjoyed, I think they have lost a lot of the equity that they had in places, because they either did not intervene at the right moment, or they stayed silent, or there's a lot of bureaucratic red tape, which I'm sure in Rotary also we feel all the time, that is preventing the organization from meeting its goals. So I think there's a lot of work Rotary needs to do as well.
Yeah. Thank you. Richard, if you have any other questions, particularly pertaining to Bharat's involvement as a Rotarian on the UN, please, by all means, you have his email address, and I know you're able to contact him. I'm sure, Bharat, that you would answer any questions that Richard.
Sure.
I'm cognizant of the time. It's now 7 o'clock. It's 7 a.m. New York time, and you must have to go to work. You must have
No, it's fine. The thing is, because I don't have to go to work.
No, I was trying to give you a leave pass. I thank you for giving up an hour of your time from 6 till 7 a.m. in the morning. I'm sure from all those that have tuned in this evening, you've been absolutely fabulous, Bharat, and you've given us the exact insight that I was looking for. Grace, I'm sure that's what you were after when you made the request. And on behalf of all of us, we thank you very much. If you ever come back to Melbourne, you're very welcome to come to a meeting of the Rotary Club of Albert Park.
Yes, absolutely. No, it's been a pleasure. It's been a pleasure. Thank you for the invite, and you're a dear friend. Anything for you, but in Rotary, it's always a pleasure to be able to see new faces, and we are friends, as in like we're all connected in ways that we don't realize. So I'm happy that I had the opportunity to present it, and hopefully it gave you a good overview of the situation. And happy to take questions offline as well. If you have any questions or anything that comes up later, I'd be more than happy to answer it. And
fantastic, Bharat. I really appreciate it. Thank you very much from all of us. And as I said, I'm not sure if you're going to go back and crawl up into bed or whatever you're going to do, but have a great day in front of you. And again, we thank you. John, I'll hand the meeting back to you. Thanks, Bharat. Thank you very much.
Thank you very much.
Yeah,
Thanks,
fantastic.
Bharat. Thank you.
Yeah.
Thanks.
Great.
Okay, bye.
Thank you. Right, we're back here. After hearing that, and I think
Quick, can we just poke your head in just to say hello to Brad? Just wave.
Okay.
I think he's
Brad,
serious.
I'm just going to grab Karen. She's just going to wave too. She's
Oh,
going to
yeah,
jump in the
sure,
background.
Yeah.
Yeah. Hey, Bharat.
How are you?
I can't hear you. He's got the thing. How are you?
How are you doing? I'm seeing you twice in 3 weeks. That's the most we've seen each other.
I use it's amazing. Yeah, yeah. What technology can do for us. Yeah, yeah. I hope we'll see you again soon.
Yes, I hope so.
Yeah.
Just thought, like
Yeah,
all the travel
absolutely.
plans are up in the air
Yeah.
for everybody this year now. So
Yeah,
how
yeah.
it
Things
goes.
will get better. Bye.
Just,
I take care.
just before you go.
I'm going to take leave.
Okay.
It was a pleasure seeing all of you, and hope to see you in person someday soon.
Yeah, see you later, Brad.
Okay.
Bye.
Thank you. Bye-bye. Just listening to that reminded me of our Premier, who's stated we're the envy of the world. I can see why he thinks that way, having heard all that.
Yeah.
We're in a pretty good spot here, I think, as you said, Stephen.